Welcome back to the Health Marketing Collective, where strong leadership meets marketing excellence. I'm your host, Sara Payne, and today we're diving into everything bold that happened at the 2024 Health Conference that just wrapped up in Las Vegas. It was packed with big ideas and bold voices. Joining me today is Erin Noel, an Associate Director of Earned Media and PR Strategy from our team here at Umbrella, who attended the conference alongside me.
Hi, Sarah. I'm excited to join you today. This year definitely lived up to the hype. Plenty of bold things to talk about, bold people, bold conversations, and I'm excited to unpack it with you.
So much fun. As we were talking, my calves hurt, my feet hurt, so much walking. You and I literally got off the plane yesterday, and I've got my conference swag on here. I thought I would be very on brand for the health conference for this conversation today.
I love it. Great conference swag once again this year. And we even got a VIP photo with the mascot Petunia this year, which was very exciting.
VIP photo, lots of celebrities. We had Busta Rhymes. I mean, there was definitely a lot of entertainment value in addition to substance, which we've got a lot to dive into and a lot to unpack today, Erin. From AI making healthcare more human to tough conversations around women's health and a whole lot in between. We are going to unpack for everybody today what we learned and the insights that we gathered from this year's conference. So as we all know, as many of us know, the theme for this year's conference was Be Bold. So in this first segment, let's hand out some Be Bold award winners to the people who said what needed to be said to help drive real change within the industry. First up for me, Erin, is Dr. Darren Weathers from the Managed Care Resource Alliance, who didn't mince words in his critique of value-based care. He said, I quote, "Value-based care may as well be trash." And this was in front of, if you recall, Erin, a standing room only packed crowd in a panel session about the link between reimbursement and preventive care. And the room was really buzzing after he said that.
I mean, I think there was a round of applause. There was some hoots and some hollering. So this was certainly something that hit the room and hit the room pretty hard. And he was not alone in this sentiment. We heard value-based care be talked about quite a bit, quite a few different sessions. And we all understand that value-based care is really meant to help, but physicians are continuing to be frustrated by how slow this payment process is. And I really appreciate how bold he was in calling out that maybe it's time for a new term, maybe even a new approach, because clearly what we know now about value-based care, it's just not working.
Exactly. Yeah, I totally agree with you on that. And on the topic of challenging norms was another great bold point of view from Mark Price from Curana Health. And this was in a session that was titled Socially Prescribed Care for Seniors. And he straight up suggested an excise tax on processed food and social media to help fund things like nutrition and social connection, which has been studied and proven to help actually advance or promote longevity, to help people live longer. And that's just not something you hear every day, especially not at a conference like this. So yeah, he gets an award from me for that.
Certainly bold, certainly something you don't hear every single day. I think we heard this a few times again. This was a big sentiment in the rooms, and that we need to start calling out how much we're spending on healthcare to treat conditions that we could probably prevent in the first place. It's not a financial issue, it's a public health issue. And he even went so far as to ask, why are we still letting these industries profit off things we know are hurting us? And again, that it was a kind of a mic drop moment in that room. And again, a sentiment we heard time and time again. And kudos to Mark for really, really saying what needed to be said and saying something bold, but also incredibly honest.
Yeah, absolutely. Yep. So he gets award number 2 for that. And in a completely different session, not the same session that Mark was on the panel for, we had a key point from Dr. Casey Means from Levels, and she said, we have to take responsibility for the chronic disease epidemic in this country. Real health will never be found in a pill. And that really felt like a wake-up call and a call to action, really, for everybody in the room.
Yeah. And I'm still thinking about Dr. Mean's conversation. She shared a little bit about her story, how she was a practicing physician and quit immediately as soon as she found out the importance of metabolic health and what we're doing as a society to our metabolisms. And she wants to be part of the solution. So I'm continuing to think about it and some of the takeaways from her conversation. And again, this was a sentiment we saw time and time again about true prevention and good health start with proper nutrition, good habits, and physical activity. And this was just such a big takeaway for me, was that there was a practicing physician who's stopping her general track, something she's been on, spend lots of money to become a physician to help people learn about proper nutrition and the actual source of good health, and that we can't rely on medicine or pills to have us be a healthier society.
Yeah, that personal story certainly spoke volumes, and the focus and emphasis on longevity was really, I think, a highlight for me in this year's conference.
For sure.
So let's shift gears a little bit and talk about some of the big trends that we saw at the conference. A lot of hot topics this year. A few of them really stood out, and I think are going to continue to obviously shape the future of healthcare, but continue to create a lot of buzz as well. And the first one for me is prevention. And we've already kind of touched on this a little bit in sharing of those quotes, but prevention was definitely a major theme at this year's conference. And I'm really pleased to see it getting so much attention. That's where the real change is going to come from. And maybe, we've waited too long for this. But now this conversation is really growing much larger towards that shift towards overall wellness and food as medicine.
Yeah. And you could tell that momentum, right? Like in previous conferences, prevention was a talked about topic, but now it finally feels like there's like a true shift in the energy and that it's being taken seriously as a key driver of health outcomes, not an afterthought, not a nice to have. It's really being something that, okay, we need to make this at the actual forefront rather than coming down after someone gets healthy.
Yeah. And one of the boldest questions on this particular topic came from Arundhati, who is head of MedCity News, editorial director, editor-in-chief at MedCity News. And she was moderating a panel, and she asked the question, somewhat rhetorical. She said, when we talk about prevention, do we mean wellness or do we mean secondary prevention? When we say that in this industry, are we talking just about secondary prevention, or are we really talking about the actual root cause here in wellness, which I think was a bold move for her and, could have potentially made a couple of those panelists that were sitting there with her uncomfortable. But I think it was absolutely the conversation that needed to be had.
And it was another one of those like kind of mic drop moments, right? Where the room goes silent at first, but then you hear claps and you hear some whistles, right? So there's definitely truth seeking to that, right? That there is some truth in that question. And I think that food as a topic related to that came up quite a bit. Dr. Alex Bellew of United Healthcare even suggested that health insurance should cover food. If we're really serious about prevention, we have to look at what people are eating. We know that you are what you eat, and we feel like that is having a really big moment again. That's having definitely a lot of energy behind that. And this is a pretty big statement from one of the largest private payers. So again, another person with a big title, a big organization asking some pretty big, bold questions.
Yeah. I mean, processed foods came up multiple times. It was under attack quite a bit. And rightfully so. And some people were saying that maybe next year we need to have food companies at this conference, and maybe they should be on the panel answering some of these questions and answering for the role that they play in overall public health.
I have to give a shout out to the Health Conference organization, because again, they're practicing what they preach. They had a lot of healthy options available for conference goers for the 4 days that we were there. And I really like to see them walking the talk. So I have to give a shout out to them. And again, to underscore your point, Sarah, there's a true shift towards understanding that prevention isn't just screenings, isn't just immunizations. It's those daily habits and choices that people every day are making around their food and lifestyle. And those are the hardest, right? Like an immunization, you can check a box. It's daily habits. That's what's going to
Yes,
have the biggest impact. And that's hard. That's hard
it
for
is
people to
hard.
do. So I appreciate that food and daily habits are starting to also become more and more. And I think next year that's probably going to be a big main stage conversation.
Yeah, I agree with you on that. But this hard becomes a lot easier when organizations like health make those healthy options, and schools, and right, like we need corporations to their in these offerings to their employees, and schools to their students, right? Like we've all got to make those shifts so that it's just readily available and accessible to us. And we've got to address food deserts as well, because there certainly is, when we talk about social determinants of health, food access to healthy, nutritious food is certainly a big issue there. Trend number 2 is not a surprise to anybody. It's AI, and it was everywhere.
Never heard of it.
We knew it was going to be there, right? It was everywhere
sure.
at health. And I think that the general consensus from a lot of the speakers and the panelists is that we're really just scratching the surface and just getting started as it pertains to AI's role in the future of healthcare. In fact, Shiv Rao from Abridge said it best, in my opinion. He said, AI will make healthcare more human than it ever has been, which is kind of ironic, but I believe that it's true, that AI has the potential to take over tasks that are bogging down providers, that is actually preventing them from having that face-to-face connection with their patients at the bedside, really freeing them up to spend more time with the thing that they went into the profession for to begin with, which is, again, the patients.
And that was a line that really resonated with me. I never thought about it in that way. But since he said it, I've been like, oh, I can definitely see how this is going to have an impact and improve the true human interaction of healthcare. He also talked about the difference between AI first companies and AI enabled companies. The ones that are AI first are really pushing the boundaries, but most companies are still truly trying to figure out how to adapt AI into their existing workflows and their existing softwares.
Yeah, that's so important. And we can't also ignore the emphasis on transparency and trust when it comes to AI. I think that has been sort of held out there as one of the things that's going to be key, critical to adoption. People need to be able to trust it. And if we're going to build trust, especially with patients, we have to be transparent about where the data comes from in these algorithms, and also what outcomes we're seeing as a result of the use of AI.
For sure. And I also could tell that there was a big shift in the conversation around AI comparatively to last year. Last year, it felt like there was a bit more skepticism in like, is it really going to deliver? Is this smoke and mirrors? Like, really, what is this going to do? But this year felt like a completely different story and a completely different narrative around AI. The sentiment was much more about embracing AI and advancing its adoption in ways that can truly improve outcomes. One key piece about this that I've continued to hear time and time again from different stages was AI can help enable healthcare professionals to deliver care at the top of their credentials. This means they can automate some parts of their job so that they can truly practice medicine at the highest level that they know how. Examples of that included things like having it call or text patients instead of the physician having to call the patients. That can take time away from actually sitting down with the patient, to remind them to do things like come in early for your blood sample, or come in or submit this form, right? So finding ways that AI can help take things off physicians' plates, which we know have been full, can really help us practice medicine at its highest level.
Yeah, so many great examples, so many bright spots, I believe, in the adoption of AI within healthcare. And if we've come this far in the 12 months since last year's conference, I can only imagine what's to come here over the next 12 months. I think it's really exciting.
And what I also found really hopeful in this piece was that it can help healthcare professionals, regardless of if they're a doctor, if they're a nurse. Like, this can have impacts across all healthcare professions, and help eliminating some of the more redundant work, giving everyone more time to have that true patient to patient or patient to physician interaction.
Absolutely. So that's trend number 2. And trend number 3 for me was really about important conversations within health, specific diseases or health issues that are finally getting the attention that they deserve and that they need. And one of the most impactful conversations was around women's health. Women's health was a big thematic at this year's conference. And First Lady, Dr. Jill Biden, took the stage the last morning of the show. She was on the main stage, and she said, she was talking about menopause and the importance of really funding it well and understanding menopause better. She said, we, meaning women, or as a society, we go from women's bodies being a miracle during our childbearing years to being a medical mystery later in life. That got a lot of claps from women in the room. And she's absolutely right. Menopause is not very well understood. People don't receive very much in terms of education, right? Like, earlier in our lives, we were educated on puberty. Right. And then we're just left into the abyss of navigating our lives and figuring it out as we go. And this wasn't the first time that menopause showed up on the stage at Health. Erin, I know you were really moved by Halle Berry. She was also there to talk about menopause as well.
I was really moved by Halle Berry. I think she has spent the past couple of years being incredibly brave and being very bold. So for me, she's at the top of the list of connecting with the theme for me this year. She's been very open around her experience with menopause and how underfunded and misunderstood it is as a condition. I think something that really struck me was she wanted to not leave her doctor's office with more questions than answers. And I think that's a sentiment we all can agree with. Like, we go to the doctor to seek more answers, to get more clarity. I can't imagine the frustration she had around with her experience, having more and more questions than answers. And so what I really admire her for is that she is taking this as a top issue, and she wants to have this as a top conversation. She wants to create a community around talking about menopause and talking about issues that are part of menopause. And instead of feeling alone with more questions, she wants to give a community space. She wants to get people connected so they can share, because that's a large part of your life. There's still life left to live. And I really appreciate her doing that and kind of taking it out of behind the scenes and giving it some attention that it truly deserves. I also really appreciate that she's taking this to DC and creating some nonpartisan support around bills so that we can have more funding for research around this. Ultimately, again, connecting people with more answers, hopefully, and giving it some real attention that it deserves.
Yeah, I mean, if we're going to drive change, we need funding in order to do so. And I also agree with you on her bravery in sharing her personal stories, because the reality is other women are experiencing these same things. And if she learned something by doing, going to these appointments and getting, not very helpful information, or chasing down pathways that actually didn't do it much for her in terms of, bringing relief for symptoms that she was experiencing, sharing that with others so they don't have to go through the same thing, is so incredibly important and generous of her, and brave of her, because some of those symptoms are uncomfortable to talk about. And she went there. She
absolutely went there. And I really commend her for all the work she's doing in this space. I think for me, it also directly ties back to the conversations that were being had around longevity, right? Is like, we want to live longer, healthy, fuller lives.
Yes.
And if we're saying we don't know much about women's health after 40, that's another potential 40 more years.
That's a problem.
That's a big issue, right? So for me, I saw that parallel really, really directly between high quality of life and longevity.
Absolutely. And I will say, I mean, I'm grateful for it, right? Like I'm entering this back half, right? And I don't want to be considered dead
or a
and
medical
irrelevant.
mystery.
What? Or a medical mystery. The other issue related to women's health that came up many times on the stage as well was reproductive rights. And some of the restrictions that are now in place are not only impacting reproductive care, but also broader healthcare access. There was a really interesting session that we sat in on, Erin, that took a look at some really interesting data. And my hair was blown back by it.
Mm-hmm. It's something that you don't think about, right? It's something that it's hard to imagine like a larger zoom out, but with this data, I was really able to see like a much more direct impact than I had thought of before. So one thing that the data that was presented shared was that new physician applications have dropped in states with restrictions, and it's creating gaps in care that can impact everybody. So it's not just impacting women, it's impacting men and women, it's impacting children. It has a direct impact on all healthcare. And regardless of your political beliefs or your backgrounds, this is something we really need to pay attention to the facts on so that we don't risk creating even more healthcare deserts, which we already know that there are, and has even more negative impacts for health outcomes on much larger scales.
Yeah, absolutely. The data, like I said, sort of blew my hair back just thinking about it. It wasn't just OBGYNs, right? That applications for OBGYNs were down. It was all types of physicians.
Mm-hmm.
And then it talked about the economic impact to that community beyond the access to care issue that you now have when you have fewer physicians entering that community, not just for women's health, but all types of physicians. So yeah, I definitely think that's going to be something to keep an eye on and see where that goes from here.
And I'll be especially interested to see that data continue as we look at, urban versus rural as well, because we already know that some of those disparities already exist. So for this to be on top of that does certainly give me pause. And so I'm interested to see this data continue for sure.
Yeah, and kudos to those that are collecting the data and sharing it out as well, so that we can all have the facts that we need to make important decisions. The last trend for me really is the big question of, are we as an industry really ready to drive real change in healthcare? And I believe Ashok Subramaniam from Centivo said, health plans are doing nothing to solve the affordability crisis in America. That's a pretty bold statement.
With plenty of those people in the room.
With plenty of those people in the room. It was a hard truth. On the flip side, people were also sort of saying, but why wouldn't the incentives be there for real change, right? Like payers could save money if we do focus more on the affordability crisis and getting people access to care so that we can catch disease early, we can manage these diseases better, and it's going to control the long-term cost. So, really both sides, kind of different sides of the argument there, saying like, yes, let us focus on prevention. Let us focus on affordability. We need to drive some real change in these areas.
Yeah. And I would say that based on our conversation already and our takeaways is that we are setting the stage for that to be the conversations in the next 1, 2, 3 years, right? So I feel hopeful that there is definitely going to be a change in the future. I think everyone can agree that value-based care is the future, but there's some serious change we need to do in order to make that happen, right? We need to reduce the administrative burden on the healthcare professionals, because we already know that this capacity is a huge issue and we truly need to incentivize them. And it's going to be a tough road. I don't think it's going to happen overnight. I think a lot of things are going to need to change, but I think there is finally a movement for this to start getting some actual traction.
Absolutely. Well, we've already talked about the boldest voices coming out of the conference and some of the biggest trends. But I think we need to also get into what all of this means for marketing leaders out there. Whether you're thinking about AI or prevention or driving change, there are some key insights for how we approach healthcare marketing here moving forward. And one of the key takeaways for me from a marketing perspective is that building trust in healthcare is more important than ever. And it starts with transparency, especially as we talked about when it comes to AI. It's really crucial to be upfront about your data and your results, but frankly, data and results, clinical outcomes, clinical impact, that matters regardless of whether we're talking about an AI solution or not. Everybody wants data and outcomes.
Absolutely. And I heard it a couple of times. We're data rich, but insights poor. And so we need to be really mindful about how we use AI and how we capture results from it, right? So there was multiple sessions that I sat in on that said, like, we can collect a bunch of data, but it's what we're doing with the data and to help create change in a positive way that's really going to really move the marble for us. We need data and insight for patients, but we also need it for policymakers,
Yes.
because that's what is gonna really create the most change.
And I think it's important, too, to make sure that that data is approachable, make sure that it's easy to understand, because, we can throw up a bunch of charts and graphs, but if I can't decipher what does any of this mean to me, then it's just data.
Right.
And it's not that impactful. And obviously marketers play a critical role in developing sort of the story around that and deciphering how to make that data relevant to their audiences.
Absolutely.
Another one of the takeaways for the conference was the importance of inclusion. And, this has been a growing conversation in the industry here in recent years, and it's an important one, rightfully so. We can't just focus on a narrow slice of the population in our campaigns. We have to make sure that we've got representation from diverse audiences. And there was a session where Dr. Jamie Rutland of Illuminate Health said, healthcare can't just be 9 to 5, meaning we need to reach people where they are in their communities and reflect their realities. Whether it's different racial, cultural, or socioeconomic backgrounds, inclusion needs to be at the core of our marketing strategies. I mean, he was talking about, I believe it was his own mother. He grew up raised by a single mother. She had, I believe, a couple of different jobs. And he's like, just talk about clinical trial enrollment as just one example. If you are communicating with her on a 9 to 5 schedule, you're not getting her. You're not getting her because she's at work, right? So it has to be nights, it has to be weekends, right? Obviously, that we've so many different channels available to us to be able to reach people, all times of day and on an hour that is convenient to them, that we definitely need to make sure that we are leaning into that.
Absolutely. And that one really stuck with me. There was plenty of other physicians in the room too. That's a hard truth to hear as a practicing physician, that what you're doing from 9 to 5 isn't gonna be enough. I mean, that can be a tough pill to swallow when healthcare practitioners are already feeling burnt out. Hearing that, oh, you need to be available even more, that's tough. That's tough. So I'm glad that he was able to put some truth to that, because I think that's very true. And another piece that stuck with me that relates to this, that was on a different stage, but we have to earn the right to talk to our patients, right? We have to communicate with them in ways that's meaningful and resonates with them. And so if that's a phone call between 9 to 5, that's not going to work for everybody. Not everyone's going to be available at those times. People have very different lives, and they need the messaging to reflect what their lives look like, but also the messaging needs to reflect the diversity, right? Like, we have to be intentional about when and where and how we connect with them. This goes back to trust too. We also want to make sure that the physicians that when patients see a physician, they can see some of themselves, they can see some of the humanness in them too, because it's healthcare, right? We want to be able to trust.
The last key insight, I believe, for marketers is that we need to lead the change. We need to lead the charge for real change. Healthcare is facing enormous challenges. We've already talked about many of them. Chronic disease crisis, issues of affordability. It's up to us to be bold and say the things that need to be said, even if it's uncomfortable. It's up to us to be committed to educating the industry around these important topics, getting the word out, helping people do things differently, make different choices in their lives. For me, marketers play a big role in that.
Certainly. And I keep thinking about too, that we need to change how we talk about impact. So while reaching millions of people is great for ROI, we talk about impression numbers, we talk about coverage, but real impact is one bedside at a time, right? We need to reach the one person who truly needs that information. It's going to take change for us to really put that at the forefront. But every single person matters, and we can't shy away from saying the things that are going to make a difference and really, really increase our ability to increase the healthcare. As a marketer, we're going to need to think about how we create impact differently too. I think it's great that we can reach millions of people, and we talk about, how many impressions we can garner and how many views we have on a certain LinkedIn post, but real impact happens one bedside at a time. And we need to make sure that we're marketing the right information to get to the right person at the right time. And that's going to take a lot of courageous actions to change how we market. But we need to not shy away from doing that and not shy away from saying the things that can actually make a true difference.
Amen to that. Well, I don't know about you, Erin, but I've walked away from this year's conference feeling extremely inspired and very optimistic about where we're headed as an industry.
Absolutely. I mean, the fact that we already have so many people who are willing to be bold and willing to speak up and speak some hard truths definitely made me inspired and hopeful for the future. I think it's going to be hard. I don't think it's going to be an easy road to change all the things that we need to change. But I definitely felt that there was big shifts and big momentum going the right direction.
Well, thanks so much, Erin, not only for joining me in Las Vegas, which I had a blast out there with you, but also for joining us in this conversation today and sharing all of your insights and everything that you learned at the conference as well.
And thanks for having me. It was fun to recap. The conference was incredible. And can't wait to see you again in Vegas next year.
I know. And for all of you out there, if you haven't gone to health, consider it. Take a look at it. Give it key consideration, because there's a wide range of topics, a lot of diverse topics, and beyond the sessions themselves, value in the networking and the business connections that are happening out on the show floor as well. So I think, if there's one thing that we've learned, it's that being bold is no longer optional in healthcare. It's necessary. So thanks for listening, everybody. And until next time, stay bold.